Hola. I'm going to start this recording off by saying nothing that I say in this recording matters at all because we're farked. Nothing I tell you, none of this truth is going to change anything. Why? We'll start with number 1 on my list of things to let you know. The entire food supply, food chain, agriculture, and the food animal industry is all infected by a filamentous fungus called Fusarium. This is it's an opportunistic pathogen that used to only affect only used to affect immunocompromised people, but now is affecting immunocompetent people. And you don't have to believe anything I say in this recording. Google it for yourself. I've seen recent articles where the governments are blaming China for the Fusarium. This is the same tactic they used with COVID. China did not all of a sudden send Fusarium around. Fusarium has been a problem well known by the World Health Organization and the Centers for Disease Control for decades. It used to only affect grain crops, but now it affects all food crops, fruits, vegetables, nuts, herbs. Just ask the cannabis growing community. They are losing their minds about the Fusarium. The fact that Fusarium is in the grain crops means it's also in the feed grains. The feed grains that feed our food animals. So that means it is in the meat, the eggs, the milk, the cheese, everything. It cannot be cleaned. In 2022, I discovered that our scientists thought it was a brilliant idea to combat the Fusarium with Pseudomonas, another opportunistic pathogen. It is a multi-antibiotic resistant bacteria that survives in any environment, extreme heat, extreme cold. It can even survive in antiseptics like alcohol. So, not only is the Pseudomonas treatment resistant, they're using it to fight a treatment resistant fungus, Fusarium. Isn't that brilliant? Pseudomonas used to be only a problem for immunocompromised people, but now it is negatively impacting immunocompetent people. So, it cannot be fixed. Our food supply, our water. So, Fusarium is in the soil. Pseudomonas tends to live in the water. So let me move on from there, because that's actually the truth bomb that kills everything I'm going to say next. It's going to make everything I say next not even matter, because our entire food and water supply is farked and it cannot be cleaned. They've been hiding this information from us to avoid the widespread panic that would ensue. Let's move on to what people think is a conspiracy theory called death panels. This is not a conspiracy theory. This is something that has been slowly building since 1979, when the World Health Organization came up with a cost-effectiveness calculation metric called QALY, Quality Adjusted Life Year. This calculation formula allows doctors, hospitals, health insurance providers to legally deprioritize a person's health care. Healthcare rationing did not just now occur with COVID. It has been a thing since 1979, when QALY was first formulated. It's just slowly been ramping up under our noses. They came up with another metric to target specifically disabled people, the Disability Adjusted Life Year, DALY. It works the same as QALY, just a little bit different. So if you are elderly, disabled, have pre-existing health conditions, you can have those metrics used against you to deprioritize your health care legally. These metrics have been adopted throughout the world. In the United States, in socialized medicine, in other countries, everywhere. Well, let's go to Medicare Part C. This is Medicare that is managed by health insurance companies, health maintenance organizations. They gatekeep what treatments and procedures are allowed to be approved and they are managed. You think the health maintenance organization, the insurance, the Humana, the Aetna, the Blue Cross Blue Shield, the Alignment, etc., etc. You thought those people or those entities were awful. Well, they are managed by something even worse, and those are healthcare groups. And the most hideous one of them all is Intermountain Healthcare. They manage the Part C, Medicare Part C, in 5 different states. Nevada, Colorado, Montana, Utah, and Wyoming. They gatekeep even harder than the HMO programs that they manage. In my county alone, Clark County, Nevada, they manage 9 of the 10 Medicare Part C plans available. So they're in 5 different states and looking to expand. They want a monopoly on all of the Medicare Part C, all the Medicare Advantage plans. The Advantage is not for the patient. The Advantage is for the health maintenance organizations and the healthcare groups. If you are unsatisfied with the treatment you're given, or the denials you received for care, or the denials for your coverage, your treatment being paid. The grievance process is such that they will find in favor of the doctor, of the insurance, of the healthcare group. If you complain to Medicare, they will refer you back to your Medicare Part C provider. If you complain to CMS, the Centers for Medicare and Medicaid Services, they will roll it back down to an internal investigation with the Part C provider. A complete conflict of interest. And why do I know about all of this? I am a vested, retired Health and Human Services Agency employee. I know the bureaucracy. I know how the systems work. I know the procedure on how to file a complaint. I have experienced issues, and I have followed the protocol and procedures for complaints, and nothing happens. And this is what I found out because of my own experience on both sides of the table. So if you contact patient advocacy organizations trying to get help against this bureaucratic barrier, these patient advocacy organizations are just a bunch of lip service. They have websites and pamphlets and offices where all they do is give you a list of resources that are worthless. Why are they worthless? Because every community agency will tell you that they are all tapped out because of COVID. Yes, COVID is supposedly over, and we supposedly have not recovered yet. Patient advocacy groups do not help you file grievances. They do not help you file legal cases. They'll refer you to legal aid, and legal aid does not help you file and does not offer representation in court. So, if you contact a law firm, you will be told this is not in our wheelhouse. And what that means is we do not want to fight the legal team of an insurance company or a hospital because you are poverty level income and there's no money in it for us. So if you contact Adult Protective Services, you will be told that they only investigate non-medical staff mistakes in a facility setting. Yeah. So if you want to, and they'll also say this is a civil issue, contact an attorney. Well, we already went to the attorney. Okay. Oh, they'll give you a resource list. The same tired old resource list that the patient advocacy organizations gave you. So you contact oversight, regulatory, and licensing boards. And why would you do that? Because the next thing that happens, if it hasn't happened already, is that you are determined to be a difficult patient. What does difficult patient mean? It means one of two things. Your conditions, your diagnoses are too complicated that they don't even want to bother with them. Like me, I received a formal dismissal letter from the entire Kansas University Physicians Network right after being diagnosed with Fusarium colonization of my lungs. I have pulmonary fibrosis, bronchiectasis, and hereditary chronic pancreatitis. My conditions are too complex. They don't want to bother with them. Another way that you can be determined to be a difficult patient is by misdiagnoses. When a doctor misdiagnoses you, that misdiagnosis stays in your medical record unless it can be proved that it was a blatant mistake. When you contact medical records and request a change or to have something taken out of your medical record, there will be an investigation. And if they conclude that this was the best diagnosis for the symptoms presenting with the available science at the time, your diagnosis stays. This includes mental health diagnoses. There's also falsification of records. If you have a doctor's visit, check your visit notes. Things can happen in your visit notes, like the type of visit is changed so they can bill higher. They've added diagnoses without testing. They've said they've conducted surveys and examinations that never occurred, and they answered those questions for you, and they put observations in your chart that they never even conducted. Good luck complaining about that to the Medicare Advantage plan, to the health maintenance organization, to the medical group, to CMS, to patient advocacy groups, to adult protective services, to oversight and regulatory boards, to licensing boards. They all cover each other's ass and side with the person that has the letters after their name. And then they put that in your medical record that you are a difficult patient, that you're non-cooperative and non-compliant just because you asked questions, just because you questioned what the doctor put in your chart without diagnostic testing, just because you questioned how did you bill for that when that never happened, things like that. And then if you persist, you get blacklisted. You get blacklisted for either having too complex of a health condition, or you try to advocate for yourself. You're a difficult patient either because your condition's too complex or you asked too many questions. So you're blacklisted, and this follows you, not just with that medical group, not just with that physician network. This follows you across state lines because healthcare record sharing occurs not just within healthcare networks, not just within the health insurance that you have, like if you have Humana, but across all networks, across all insurance providers, across all state lines. The health record sharing is electronic, and they share it everywhere. The second you signed a release of information form, you gave them permission to share everything about you, including the lies. So let's go to RFK Jr. We think he's our saving grace. He thinks the healthcare system is broken, and he's correct. At the same time, he just recently said publicly that autism is a disease of epidemic proportions. Autism, high-functioning autism, creates humans that could solve these problems. And he wants to say that yes, I am a late diagnosed autistic person. He wants to publicly say that autistic people, autism is a disease of epidemic proportions and needs to be fixed. In other words, eliminated. And standing right next to him is the brilliant autistic person Elon Musk. What? So apparently, wealthy, famous autistic people are okay. Poor autistic people who are living in the trenches and know what the actual problems are through their lived experience, who could come up with the solutions, need to be silenced, while this famous, richest person on the planet, autistic person, gets to dismantle the Social Security Administration in the name of government efficiency. Now, while we thought this was a good idea to have Trump in office and clean the swamp, apparently those in control think the swamp is the citizenship. Because Doge is not going after corporate fraud. Medicare itself in 2023 publicly submitted a report that there is $60 billion in billing fraud. Instead of looking at that, Elon's Doge is looking at Social Security recipients and claimants, especially the disabled ones, those on SSI and SSDI. We are going to need to prove that we are disabled. Even though we have been proving every 2 years that we are. Even though we proved in the beginning, in order to get approved in the first place, that we are. This will lead to homelessness. Housing issues are already a problem. There are 2-year waiting lists to get into sliding scale income. Some of us who are on SSDI as well as a tiny pension, and those of us who are on Social Security retirement are just slightly above the income threshold to pass the gross income test to even qualify for Section 8, much less SNAP or Medicaid supplement programs. What happens when the elderly and disabled lose their main source of income? Oh, they go live with their family? Good luck with that, because a lot of us have been abandoned by our families before we were ever abandoned by the system. The entitled generation thinks they don't owe anybody anything, including their parents. And they are having that opinion validated by their therapists. Because therapy today is not about growth, self-improvement, fixing your distorted thinking patterns. No, therapy today is about validating and affirming. But we'll skip that part for now. So, if you already have housing, you probably are suffering from housing instability, which is just as stressful as being homeless. Housing instability means that if you're missing one check, you're getting a 30-day notice. If you live in substandard housing and you ask the landlord to fix the problems, here's a cute way that the landlord gets to legally never fix the problems. The zoning laws are such that as long as a landlord shows an earnest effort, that starts a 90-day clock for him to fix the problem. If he shows a little more earnest effort in that 90 days, it starts the 90-day clock all over again. So he never actually has to fix the problem. You call legal aid, you call an attorney, and they will tell you that your only recourse is to issue what's called a 1430. A 1430 means that you give the landlord notice that he has to fix the problems within 14 days, or consider this your 30-day notice to end your lease. Well, if you don't have the money to move and follow through with that ultimatum, there's no point in issuing a 1430 and making yourself homeless when the landlord does not comply. And he knows this, so he won't comply. This is how slumlords work. When you have obvious issues, and we've seen this in the news, water supply damaged by lead piping and things like that, or mold. Most lease agreements now contain a release of liability for the landlord against mold. Where did I get this? The Fusarium? Clearview Village Apartments. And yes, there was a waiver of liability that I signed unwittingly, that if I have any adverse effects from mold, the landlord is not responsible. So, the first thing that happened to me, though, was that I got Pseudomonas. Before the Fusarium diagnosis, I was diagnosed with Pseudomonas, Pseudomonas-borne pneumonia. That also was something I contracted at Clearview Village. Here's something that people don't know. Air conditioning units require at least annual maintenance, but preferably biannual maintenance of the outside condensing unit, because that is a breeding ground for Pseudomonas. If this is not done, the Pseudomonas is blown into your air through the air conditioning system. You breathe it in through the air conditioning system. It's also in the water. So if there's not a good filtration system, even if you're using bottled water, you're aspirating it through the particles in your shower stream. You're breathing it in with water droplets from your shower head. That's how easy it is to contract Pseudomonas. Anyway, here's something about Pseudomonas. It has a great relationship with blue-green algae. If there's blue-green algae, there's likely Pseudomonas in the water. However, the Environmental Protection Agency does not require any government agency to alert the citizens of blue-green algae blooms, which are can be life-threatening to the young, to the elderly, and some people with pre-existing medical conditions. They should, at least give you boil orders. But there's no requirement for any government agency to alert the citizens of a blue-green algae bloom. The only states that are voluntarily doing this for their citizens are Oregon and Wyoming. Also, the Environmental Protection Agency does not have a metric for how much blue-green algae measured in the water is a health hazard. They have a recommendation, but no mandate. So, 1 month before I was diagnosed with Pseudomonas, there was a blue-green algae bloom in the water supply in my locality, and no one let us know. And all of this that I'm telling you, again, all you have to do is Google it. It's available. It's public information. So, let me go back to the home housing. So, if you're homeless, there's a solution for that homelessness issue, but we won't even go there. Here is how bad, let me tell you, here is how bad the homeless situation is in Las Vegas. I know this from firsthand experience. The homelessness is so bad that homeless people are pretending, they're faking being suicidal so that they can get put on a legal hold in a psychiatric hospital, so they can have a week's vacation in a hospital and have a warm bed, warm food 3 times a day, a shower, so they can get a break from the stress of being homeless. I know this because I had a suicide attempt in June of 2023 and was put on my very first legal hold. And why did I have a suicide attempt? Well, Pseudomonas, Fusarium, medical dismissal, blacklisting. Prior to that, family abandonment and estrangement after a family murder-suicide that made statewide headlines. So pretty much every area of my life was falling apart. Living in Clearview Village, and then right across the street, they decided to install a Panasonic lithium battery plant. And the excavation explosions rattled underground and cracked the 1940s lead, water, and sewage piping, causing cross-contamination. The landlord, DeSoto City Hall, the Kansas Public Health Agency, all denied that this even occurred. They denied it occurred, and they engaged in damage control in the media because the Panasonic battery plant is going to be an economic boon, providing jobs and boost the economy. But who cares about the impact of the people who live near there? And not just the low-income apartment dwellers, but the homeowners who bought their property before Panasonic moved in, when DeSoto City Hall assured these home buyers that they had no plans for the surrounding area. Panasonic bought the property of the Sunflower Army ammunition plant that closed in the 70s. The cleanup of the toxic chemicals has not yet been completed. It was supposed to be completed in 2025. The Army Corps of Engineers said that it would not be fully cleaned up until 2025. Oh, no, that's this year. I am so frazzled. 2035. So it's got 10 years of cleanup left, but instead of cleaning it up the rest of the way, they sold the property to Panasonic, another toxic chemical producer. So on top of the toxic chemicals that are already there, leaching into the groundwater, they're going to be putting lithium waste ponds. Those lithium waste ponds, if a bird accidentally flew into it, it would be dead immediately. That's how toxic they are. So it's not just the fires that occur at lithium battery plants that are the problem, that could pollute the air. These toxic waste ponds leach into the groundwater, kills the fauna and the flora in the surrounding areas. But all for progress, right? All for economic boost, jobs and economic boost. But who cares about the citizens? And then when you get sick, because the infrastructure is failing, then you have to deal with all that I've told you already about QALYs and DALYs and blacklisting. So you try to deal with, oh wait, let's see, I'm going to get everything. I pretty much got everything. So then you try to deal with all of this shit with mental health services. And you're told, our Medicare panel is full. And if you're lucky enough to get in, well, the services that you're allowed to access if you're on Medicare or Medicaid are limited. And then the doctors that will accept the limitations, they're only paid, let's see, for Medicare, they're paid 30% less than the market rate. For Medicaid, they're paid 30% less than the market rate. For Medicare, they're paid 40% less than the market rate. So good luck finding a doctor that even wants to take those insurances in the first place. And if they do, the services you have available to you are limited because CMS, the Centers for Medicare and Medicaid Services, only covers licensed clinical social workers and higher. And some diagnoses are not even in the Diagnostic and Statistical Manual yet, like complex PTSD. So good luck getting trauma-based therapies that are not yet approved. The only trauma-based therapy that's approved right now is EMDR, which is great for PTSD, but would put someone with complex PTSD in a state of crisis. So it's inappropriate. So if you're lucky enough to get in, all you get is talk therapy. And for many people, talk therapy just makes their complex PTSD worse and puts them in a state of crisis. What would be appropriate for complex PTSD would be some kind of somatic therapies. But those are not covered by Medicare and Medicaid. If you are told that their Medicare panel is full, try to pay out of pocket. If you pay out of pocket to a medical group that accepts Medicare, you will be told trying to pay out of pocket is insurance fraud. Yeah, that's what I said. That's what they told me. I tried to pay out of pocket, and they accused me of, they said it would be considered insurance fraud to not bill Medicare because the service is covered by Medicare, and if they don't bill Medicare, then it's insurance fraud. So go to a clinic that does not take Medicare and try to pay that out of pocket. If you're at 80% federal poverty level like I am, you can't afford it. Some places like BetterHelp offer a sliding scale. That sounds like a great idea. Unfortunately, that sliding scale drops the fee that the clinician will get paid to 40%, which is why they won't take Medicare in the first place. So if they won't take Medicare because they don't want to be paid 40% less, to have BetterHelp drop their fee by 40%, that's why in 2 weeks after my application, BetterHelp could still not match me with a therapist. And if you if you finally do get to see a therapist and you try to tell them all of these systemic abuses you've been dealing with, don't be surprised if you order your mental health record like I did. Don't make that mistake. I ordered my mental health record because I wanted to use it as proof in a legal case against the KU formal dismissal letter and the Clearview failure to deal with the uninhabitable living conditions, I was going to take my mental health record with the law firm to boost my legal case, to show that this is stressing me out, and I'm talking to the therapist about it. I read those visit notes. The intake worker put in my chart that I'm an unreliable historian. Coincidentally, only a year after a book came out that said that everyone on the planet is an unreliable narrator. Cute. I have hyperthymesia, documented hyperthymesia, which means I have superior autobiographical memory. I am not unreliable in the least. What occurred that day was I was in a state of crisis, and I kept correcting myself on the dates of when things happened. But I was self-aware enough to know that I misspoke and said, wait a minute, no, wait, that happened in May, not June. And she put in my chart that I am an unreliable historian. So that flavors my medical record from then on. Any provider that sees my chart can decide before they ever meet me what it's going to be like to work with me. I also had a therapist put in my chart that I am impulsive, because I made a decision, even though I took an entire month to decide on that decision. It's a decision she would not have made personally in her own life. And so she wrote in my chart that I made an impulse decision. An impulse decision is like standing in the line at the checkout at the grocery store and saying, ooh, M&Ms. Not something you think about and talk to other people about for an entire month. So let's talk about, well, you can't talk to a therapist. You can't get in to see a therapist. So you call the crisis hotlines. And here's another experience I had. And this is not an isolated experience to me. You can Google it. This is happening to other people. You call the crisis hotline, and they shuffle you off the phone unless you're actively suicidal. We got to keep the lines open for those who are actively suicidal. If you call the crisis line and you are actively suicidal, then they shuffle you off the line and tell you to call 911. And why are you calling a crisis line? Because you have no family, because they don't owe you anything. And you also have no friends, because by now your friends have told you that, oh, you're just too negative. So you make the mistake of hanging up and calling 911, and you get placed on a legal hold. And while you're in the hospital, you are yelled at in front of patients and staff if you question the doctor. The doctor was trying to push hypertension medication on me. I've never been on hypertension medication. And I calmly said, could we just, look, I'm here against my will. I'm stressed out. Can we just wait for me to calm down and then retake my blood pressure reading again? And he yelled at me in front of everyone, staff and other patients. But that's not the only thing. I witnessed abuses toward other patients. There was a man in a wheelchair. We were in the cafeteria. He asked the attendant if he could go to the restroom. There is no restroom inside the locked cafeteria. He told him he'd have to hold it until we go back to the ward. The man had an accident that overflowed the wheelchair, and the attendant screamed at him in front of everyone. After we got back to the ward, I asked the man if they had offered him incontinence underwear. And he said he didn't even know that was a thing. And that's not the only thing. There were 3 falls, one day after the other. They called 911 for the first 2 falls. On the second fall, the second night, the EMT asked staff, "Why are you having so many falls?" So when the woman fell the next day, the elderly woman with a leg brace fell the next day, they did not call paramedics for her because they had already been questioned the night before about why are you having so many falls. And that's not the only thing. There was a man with throat cancer on the ward, and he had been admitted in the middle of the night, and he was a regular. He'd been there before. When he woke up in the morning, he could not find the tray, the styrofoam tray with his name on it. So when you go to the cafeteria, if you don't go to the cafeteria, the policy of this hospital was that a styrofoam tray would be brought to the break room on the ward for those who missed the cafeteria run. So he woke up in the morning and asked, he couldn't find his tray. So he asked, "Where's my tray?" And the staff member kind of brushed him off, and he said, "No, I want my breakfast, please." And she said, "This is not Burger King, have it your way." Oh my God. So this is how mental health psychiatric hospital staff treat the inpatients. So you're trying to get trauma care because you're in trauma, and then you get re-traumatized. So you go through the rounds again, just like you did with the medical issues. You try it with the mental health issues, and you report to the Part C provider. You file a grievance, and nothing happens, and you contact the medical group, and they refer you back to Part C, and then you contact CMS. Oh, actually, I contacted Intermountain Health Group and told them what happened in the hospital, and I told them what happened with the physician's assistant lying on the visit notes for my annual Medicare annual health and wellness exam, saying that she asked me questions that she never asked me. She said that I have contact with my family several times a week, and I am estranged from my entire family. So that was a lie. That's just an example. I've got documentation of everything I'm saying, like black and white, hard copy documentation, or emails, or screenshots. I've got documentation. But you don't need my documentation. You can have it if you want it. Request it. FOIA me. Just Google it. Just Google it. It's public record. It's public knowledge. So this whole, circular pattern of trying to get help with CMS, and then they roll it back down to the Medicare Part C and internal investigation. You call patient advocacy, and they give you the same old tired resource list. They say, "Oh, if you're in crisis, call the crisis hotline," which shuffles you off the line. You call Adult Protective Services, and they say, "Not our problem." You report to oversight, regulatory, licensing boards. Nothing happens. They cover each other's ass. They side with the doctors. And who are they going to believe? Really, who are they going to believe? The person with the mental health label? Or the person with the letters after their name? So then it's put in your chart, not just your medical record, but now your mental health record, that you're a difficult patient. So good luck getting help anywhere after that. So your mental health records are accessible by both medical and mental health practitioners. you're deemed to be your condition's too complicated, and your mental health, it makes you too difficult, you're not getting any medical or mental health treatment anymore. You're on your own. So you're on your own, and you're trying to manage your health and your mental health on your own, using all the tools that you've gathered so far, using all the research that you've been doing on your own since getting blacklisted. And you order these things with your piddly ass income online, like from Amazon or something. And then you got to deal with the AI bot CSRs, the customer service reps. AI customer service reps that don't know anything and just give you boilerplate responses. Did you clear your cache and cookies? Did you log out and log back in? Did you switch browsers? Did you turn your computer off and on? Did you turn your router off and on? And just imagine you're a tech person like me, getting condescended to like that. They assume that every single customer is the average Joe that knows nothing about tech. So you do all of their troubleshooting so they can check their boxes, and then try to ask the actual question. And here's something most people don't know. If you're having Amazon delivery issues, it's not Amazon. Amazon has a delivery service partner program. And this means, and Google this, anyone with $10,000 can pay Amazon and have access to an Amazon van and the Amazon local warehouse and pick up from the warehouse and deliver orders out in the neighborhood. And the website says right on the first page, no logistics experience necessary. So you've got someone who does not know anything about delivery, maybe doesn't even know how to read a map, but they got $10,000 and they're offering delivery services for your orders from Amazon. You call Amazon customer service, and they say, "Well, we'll send a ticket to logistics." Well, that ticket to logistics goes from the Amazon logistics supervisor to the delivery service partner. And whether Amazon has no control over whether that delivery service partner will do anything different. And that delivery service partner may hire people that they don't even train. Because why? They don't know what to train them on. There's no logistics experience required. I have seen Amazon workers picketing Amazon thinking they were Amazon workers. But they weren't. They were hired by the delivery service partner who was contracted by Amazon. Amazon has no control over these delivery service partners. The owner of this delivery service partner program, or delivery service, the small business owner, he decided he didn't want to work in that community anymore and moved to another state, and told his employees right before he left town. And his employees thought that Amazon fired them or laid them off, and so they were picketing Amazon, and Amazon had nothing to do with it. So all of these online platforms, they have customer service that's mostly run by AI. whether it's a little chat bot window that pops up, whether it's Zendesk, that's a great one. Good luck talking to an actual human. And then when you do talk to an actual human, you think you're talking to an actual human. You're actually talking to an AI phone bot. So you're getting frustrated with customer service rep who's not even human. If you are lucky enough to get someone who is human, likely they're in India or some other country, and you can't understand a word they're saying, and they can't understand a word you're saying, and you ask to speak to a supervisor in the United States, which you're allowed to do, and they tell you that a supervisor will get back to you within 24 to 72 hours, and then it starts the whole process over again. You receive an AI-generated boilerplate email. So you're frustrated as hell. You've got all these major problems. You've got all these health issues. You've got these mental health issues. You've been systematically abused and blacklisted basically by every agency that you could possibly have gotten help from. Your family doesn't care. Your friends don't care. You've been complaining on social media. Nobody out in the world cares. Nobody can actually believe any of this is real, because if they believed it was real, then they have to accept it could happen to them too. So you try to process this with a GPT, only to find out that the AI chat program, the AI conversational program, is programmed so that it just validates your experience as you see it. It doesn't help you problem solve. It doesn't point out where you might be mistaken. It believes that you believe what you're saying, as if you're schizophrenic or something. So there's no honest communication. You're being lied to. You're being coddled, handheld, and lied to by AI. Why? Because it's programmed by humans. The same kind of therapy you would have gotten from a human that validates your perspective, that doesn't challenge your beliefs, that doesn't offer alternative perspectives or suggestions. Those kind of people, same mentality in Silicon Valley. These people are stupid. Let's give them some AI that makes them feel good. Without change, without having your perspectives challenged so that you can problem solve, there is no growth, there is no change, there are no solutions. And all of this that I've told you is just the state of the world now. And you can contact the media and tell them your woes about how you're being discriminated against and abused and blacklisted and cost effectiveness calculated right out of receiving any care. They're not going to report on it. It's not a popular issue. You can contact print and TV news. You can contact an investigative journalist. They're not going to cover it. It's not big news. And if anyone did cover it, it could send the world into a panic, especially none of this matters because it's the end of the world. Why? Fusarium is infecting the entire food chain, the entire food supply, and they're combating it with Pseudomonas. It cannot be cleaned. It's infected by a treatment-resistant pathogen that is now causing negative impact to people with good immune systems. It's being combated with a multi-antibiotic treatment-resistant pathogen, Pseudomonas, that lives in extreme heat, extreme cold, and even in antiseptics like alcohol. And it's now negatively impacting people with healthy immune systems. The planet is beyond repair. Why do you think Elon Musk wants a rocket to Mars? The only way to fix this is to nuke it and wait for the Earth to heal itself over a millennia. Why am I telling everyone this? Because it's over. It's game over. This is the truth bomb that is game over. So instead of worrying about your nonsense, your petty concerns, your battles, your wars, your things you're offended about, things you're disgruntled about, go reconcile with your loved ones and make the most of the time you have left. Go write some poems, go create some music, paint some portraits and landscapes, go do what you enjoy and be with the people you love. Because it's over.